Welcome. Thank you for coming today. This is yet another historic day in the implementation of Healthy San Francisco. I think that the media and the public has followed us over the last 2 years, and they have seen how we have consistently grown the program to include more individuals and to include more providers. And so today we're going to give you a sense of where we are in terms of our enrollment into the program and the addition of a statewide health plan into our provider network. We're going to be first hear from the mayor, and then I'll come back and give you a sense of who else will be speaking today. Thank you.
All right, thanks, Tangerine. And just want to acknowledge Tangerine. She's really, you want to know the human face of the implementation of our universal health care strategy. It's Tangerine who's just done a magnificent job. We were successful in recruiting her. She had stepped away for a while, and then we got her back into our fold, and we're immeasurably blessed and appreciative of all her extraordinary work. And I realized that for all the kudos we've offered so many people, we haven't offered enough to Tangerine. So let me first and foremost just again congratulate you on everything you've done. Thank you. Unbelievable. This is, I don't know if I would call it a wow moment, because then, then I take away from sort of the intensity of that word, except this is a wow moment from my perspective as it relates to healthcare in San Francisco. This is a big deal. To get Kaiser to participate as substantively, and you'll hear in detail what I mean by substantively, into our universal health care plan has serious ramifications in terms of not only our own capacity to lead by example in terms of what we're trying to achieve in the city, but I think in terms of what this means for the state of California and what this can mean for the rest of the nation as President Obama enters into this remarkable period in the next few weeks and months, advancing the ideal of universal health care in this country. What we're doing here in San Francisco has gotten a lot of notice. I know a lot of you recognize that, but I want to underscore this. The White House is paying attention to what we're doing in San Francisco. Congress is paying attention to what we're doing here in San Francisco. And what we're doing is a template as a public plan for, I think, a lot of the discussion that's being advanced with bills that may be introduced as early as next week federally to initiate this remarkable agenda for universal health care to conclude, hopefully, by sometime in October. I'm blessed now to be the liaison between the White House and the mayors across this country. We had a call just 2 days ago with Valerie Jarrett, and I think 100+ mayors from across America, Democrats and Republicans from every conceivable state, where mayors now are going to be much more engaged and engaging in the dialogue around universal health care, not just governors. And what we're looking to do is example models, and there are just not that many models out there in the United States that people can point to. A lot of people are asserting philosophy, asserting point of view. Few people can demonstrate capacity, and San Francisco is really a leader in that respect because of the people you see up here and because of all of you behind the cameras. And so I'm immeasurably grateful for that example and that leadership and that stewardship. And Dr. Mitch Katz, of course, has just been front and center, giving us the optimism that now, I think, pervades and is a big part of the announcement today, that we can actually achieve this goal and we can achieve this remarkable milestone. Already 2/3 of San Franciscans now have access to quality health care that did not have the privilege or opportunity to get that health care just 18 months to 22 months ago. We are now have enrolled some 41,600 people. We believe that the universe is actually around 60 to 63,000 that could avail themselves to this program. So again, we're well on our way of reaching our goals. We started small, people earning up to 100% of federal poverty. We then increased it to people earning 100 to 300% of federal poverty. Now we've reached out to people earning up to 500% of federal poverty. Those are families of four earning roughly $110,000 a year, not insignificant. The next phase, we want to roll it out to everybody else, 500% of federal poverty plus. So it's been a very deliberative phasing of this program. It is extraordinarily easy to navigate. call 311, and we will direct you. And through that process, you can walk into a clinic if you're eligible and literally within minutes have a medical card, a photograph, and a medical card that gives you a medical home and immediately provides the security and safety that if you're sick and you need an ambulance and a hospital, that you are not going to go bankrupt, that you will be taken care of based upon, again, your ability to pay. As you know, it's $20 a month for people earning 1% to 200% of federal poverty. People earning 2% to 300% of federal poverty, it's just $50 a month. 3% to 500%, it scales up, starting at $100 to $150 a month at the high end. And by the way, that goes down based upon employer contributions. So it's an extraordinarily affordable program. The big missing piece, and I'll quickly wrap up and turn it over, is that we've had a plan that has gotten nonprofit hospitals involved. And you recall about a year ago-ish, we had an announcement over at St. Francis, I think it was, where Catholic Healthcare West and others stepped up and stepped in and said, we will provide quality health care in our hospitals, not just the community clinics. And that was based on geography. It's based upon a relationship with community clinics. It was very thoughtfully done. Kaiser, though, had sort of been bouncing around, and I want to just close a loop. Kaiser was one of the first to step up and support our efforts when I pulled together with Supervisor Amiano this task force. They helped provide a lot of the actuarial work to determine that the number of uninsured are actually a lot less than we had originally projected, and put some numbers on this issue that gave us a set of facts to which when we could endeavor to provide a solution to the problem that we identified. Kaiser has been front and center in wellness. My favorite commercial, and I mean this, I say it all the time, is that little kid with that giant liter of Pepsi or Coke or whatever it was, saying he's got a drinking problem. I love that little kid talking about his drinking problem. It's a great commercial about wellness and prevention. We're only 4 cents of every federal dollar on health care, $2.2 trillion a year, 16.5% of our gross domestic product goes into health care, yet only 4 cents of every one of those $2.2 trillion goes into the prevention and wellness side. That's wrong. Kaiser understands that, and now Kaiser is going to participate in this program by providing thousands of people that do not have access to a primary care physician or access to quality health care. They're going to provide that access at extraordinarily discounted dollars. And they can talk about that because I'm apparently not supposed to get into too much detail on that. As Kaiser has, well, they haven't asked, but I believe I indirectly was asked not to get into too much of the finances, except to say that this works for us and somehow it's going to work for them. That's a wonderful thing. So this is a milestone. This is, for me, a wow moment in our universal health care strategy. This gives me more optimism that we'll actually complete this job. We know we're not perfect. We know this model doesn't work everywhere. We know it's not health insurance. And we know the limitations of that. But we know what we had before, and we know what we have today, and we know what we're about to get July 1st when Kaiser now launches their part of their participation in this effort. And I think it's a very significant moment indeed. So again, to everyone that helped conceive this, members of the Board of Supervisors, members of labor that stepped up and worked side by side with the business community, to all of the advocates that helped us organize this 2 years ago, to Dr. Katz, who led the charge and has been the leader, the outstanding leader that has brought all of this together with Tangerine's extraordinary detailed implementation and leadership. I congratulate you, and to Kaiser, I'm immeasurably grateful. This is a big deal for the city, and as I said, a big deal for the state and the nation, because this is a model that needs to be shared and needs to be scaled, and the timing of this simply could not be better in light of where the president wants to take us in the next few months and Congress. So thank you all very much for being here. And Tangerine, I'll turn it back to you for the subsequent introductions.
Thank you. As the mayor indicated, Kaiser has been with us every step of the way, and really that has been under the leadership of Christine Robish, who serves as the Senior Vice President and Area Manager of Kaiser Permanente, San Francisco. She will be speaking, and she'll be joined by the Physician-in-Chief for Kaiser Permanente, Dr. Robert Mithun. Thank you.
Good morning. Thank you, Tangerine. Thank you, Mayor Newsom. Thank you, Dr. Katz, and all of you that are gathered here today. On behalf of Dr. Robert Mithun, our Physician-in-Chief and my partner at San Francisco, I am pleased to announce today that effective July 1st of this year, Kaiser Permanente will begin to see Healthy San Francisco participants. And what that means is that for those San Francisco residents who wish to enroll in the Healthy San Francisco program, Kaiser Permanente will be providing health care to those individuals here in San Francisco. And that includes primary care, tertiary care, emergency care, hospital care, skilled nursing care. This is an exciting day for us. It is through the efforts of many of you that this day has come to fruition. Kaiser Permanente is committed to this community in San Francisco and to all of the communities that we serve. It's an integral part of our mission to ensure that everyone has access to health care and that we are improving the health of the communities that we serve. So by participating in Healthy San Francisco, it's another step forward to ensuring that more people have access to care. And when more people have access to care, we have healthier people and therefore a healthier community to live in. So we'd like to thank you, Mayor Newsom, for your leadership on this effort. We are privileged to be a part of it. We're excited to operationalize this effort. And thank you for all of you coming here today.
Thank you, Christine. We'll now hear from Raymond Baxter, who is the Senior Vice President of Community Benefits Research and Policy at Kaiser Foundation Health Plan. They have spearheaded a number of efforts to support community-based services for individuals outside of their members, and I believe that Ray has been very helpful in getting us to where we are today. Ray?
Thank you very much, Tangerine. I think I'm also here as part of history. In 1992, in the last terrible budget crisis that we had in this city and this state, I had the privilege of serving as Director of Public Health in the City and County of San Francisco. And in desperation, I called a meeting of the leadership of the hospitals, the community clinics, and our own operations at San Francisco General and our health centers to try to figure out if there wasn't a way that we could do things in a radically different way, to pool our resources in a very different way and make sure that everyone in this city had access to care. We weren't successful then. So no one can appreciate like I can the accomplishment, Mr. Mayor, that you and Mitch Katz and the Health Commission and the Board of Supervisors have achieved with the Healthy San Francisco program, and particularly appreciate the leadership that Tangerine has shown in this program. Kaiser Permanente is deeply committed as part of our mission as a nonprofit organization to health in our communities, not just for our members. And in many ways, we've engaged in this city and in others in supporting our safety net providers, working with public health departments, working hard around healthy eating and active living for the whole population, and being activists around public health and public policy that promotes health. We were very active a year ago in working with many people here and in other rooms to try to achieve universal coverage in the state of California. We came close and we didn't make it. We are very active now at the national level in trying to achieve universal coverage for everyone in America. and we hope we're going to make it this time. But this particular program in San Francisco is a model, shows that it is possible to get there, and we are very proud to be part of this program in San Francisco, not just for the people who live in San Francisco, but as a model for the country that we can achieve our objective of coverage and access to care for everyone. So thank you very much.
Thank you, Ray. Finally, we'll hear from Dr. Katz, who has been instrumental in helping me and supporting me and our staff and everyone on this project. Thank you.
Thank you. So going around the country, I hear a lot of politicians talking about the need to achieve universal coverage, but Mayor Newsom is the only one who's achieved it. We have a program model that's now already covered more than 2/3 of the uninsured in San Francisco with a comprehensive set of benefits. Today's announcement just expands that by showing that our model is transferable to the largest HMO managed care model in the state of California, and we're incredibly grateful to Kaiser for stepping up and being part of the solution. When I think about why does it work? Why does Healthy San Francisco work and other attempts have not? It's because everybody is doing their part. See, if you set out and try to insure the 47 million uninsured in the United States, and you just say, well, we want to provide them insurance, that's not a hard question, right? We have lots of models of insurance. It can be public like Medicare or Medicaid. It can be private managed care like Kaiser. It can be private PPOs like HealthNet or Take Care. We have lots of models of insurance. What no one can figure out is how are you going to pay for it? Because if you subsidize it only a little bit for those people who are low income, they'll never be able to afford it and they won't take it. If you subsidize it a lot, they'll be able to take it, but you'll go broke. And nobody has solved that problem. In fact, even in Massachusetts, which has had the most success as a state, they're running into heavy financial problems now, despite the fact that they have the lowest percent of uninsured of any state in the U.S. And that's why they were able to go forward with a plan. Their uninsurance rate lower than ours, much lower than California's. So here we've been able to do it, and we've been able to do it because of people like Kaiser who say, we want to be the solution. I'm not going to tell you about the finances either, because the finance, we never give individual rates. But what I can tell you is that Kaiser is agreeing to provide this service at much less than their cost. And that's true of all of the providers we've worked with. What we've said to everyone is, we can't make your cost any more than the federal government can provide insurance for everyone. But we know you're taking care of these people. We know it's part of your mission, and we can help take care of that cost. So when we added Chinese Community Health Plan, for example, we for the first time included private doctors seeing their patients in their private offices. A lot of people thought that wasn't doable. How would that work? You have a provider who just has 3 or 4 patients. She's taking care of 2 Healthy San Francisco patients. How will that work? It's working. That's been going on now for 6 months. And so we proved that Healthy San Francisco can work in the individual doctor's office. It can work in the public health clinics. It can work in the private nonprofit clinics. And now we know you're going to prove that it can work in the largest HMO, and we're so proud. I want to appreciate my commissioners who are here. This has been a collaborative effort with the Health Commission. President Illig, Vice President Malera is here, and without their support, this could never happen. And a last but very deeply felt thanks to John Gergerino and his entire staff at the San Francisco Health Plan. They are another part of our partnership. When we said this, that we were going to do this, mayors, sensibly, Mitch, how are we going to afford this? And one of my promises to him was, we're going to create nothing new. You see, we've created nothing new. Right? I went to the health plan, and John, you run a great health plan for managed care. Will you be my TPA? Will you be our third-party administrator? And they just did it. We didn't build a new health plan. We didn't build new hospitals. We didn't build new clinics. And we're not building and never could build, the largest HMO. What we've said is, you're good at what you do. Come be a part of the solution. So thank you all, and we can stay around for questions if the mayor's schedule allows.
Mr. Mayor, would be interested in your observations on how this model program is growing, expanding while there are deep budget cuts.
Yeah, well, great question, an appropriate question. As you recall, just 2 days ago in my office, I announced an expansion of Healthy San Francisco and this plan. I announced the intention to put, I think, $9.45 million of additional resources into this program, and I think that translates roughly to another 9,000+ individuals that will be fully funded because of that commitment. So we actually expanded Healthy San Francisco's universal health care plan in this budget, and we have maintained a commitment to our community clinics, ours which had been expanded over the last number of years to accommodate this program. We maintained that network of delivery by making sure that they had the resources to allow this to succeed.
You mentioned something about a statewide program. Could you expand on that?
Well, I think, as Dr. Katz was just saying, I mean, Kaiser's not just a San Francisco company. This is one of the largest HMOs in the United States, certainly the largest in the state of California. The fact that they're participating in this public plan is not insignificant. I think it's very suggestive of a commitment that Kaiser's making that I imagine, if it's successful, could be scaled and could be replicated and exampled in other counties across the state of California. So when I talk about consequences, the consequences are direct to San Francisco for the moment, but I look at the opportunity, of course, of scaling this. Dr. Katz has traveled across this country, and his staff has had the opportunity to invest in making presentations across this country about our program. Now they'll have something additional to share, and I assure you this will raise some eyebrows in a positive sense with people across the state of California and across the country saying, wait a second, interesting, Kaiser is now participating. And I imagine Kaiser's going to get some phone calls in other parts of the state and this nation. And this announcement, I think, will go a long way of servicing our belief that there are counties like LA County and Contra Costa County and San Mateo County. Dr. Katz and I were talking late yesterday afternoon specifically about those 3 counties that can, I believe, quickly scale this type of solution in their respective areas. So I think this will only further that likelihood.
For Kaiser, why now and not 18 months ago?
That's a good question. As has been indicated before, we've been participating in terms of providing technical expertise, planning, et cetera, and we wanted to be very thoughtful. Whenever we approach any new program, there's a lot of planning and investing, if you will, on the front end of things. And so our intent was really to be thoughtful. It's a new program, it's a new effort, and we wanted to ensure that we would be absolutely 150% successful.
The old adage, seek first to understand, then to be understood. I think they were wise, but I think it's important to note, again, that Kaiser, you look at our Shape Up San Francisco model. We just got an award in Washington, D.C. as a best practice in America. Kaiser's been front and center in those efforts. So they've really been a big part of a narrative of our wellness and prevention, which to me is the most important part of this. Look, once you establish the access, which is usually, it's the debate. Once you establish the access, then the debate goes away. Then you get to focus on what we all need to be focused more on, almost exclusively on, and that's keeping people well, as opposed to treating their sickness. It's a lot less expensive to keep people well than it is to treat them after they're sick. And so that's where the dollars need to be redirected, and that's the opportunity of partnerships with Kaiser that are extraordinary. I personally I believe no one does it better than Kaiser in terms of understanding that narrative. That's why I exampled just even their public service announcements and their commercials. They get it, and they're demonstrating it with real resources. And so that's why, again, in every way, shape, or form, this is significant for us, because this is where we want to shift the debate. In a year or two, I hope all we're focused on is now keeping people well and making investments in what we're eating, whether we're exercising, what we're drinking, land use planning associated with health and wellness, issues of environmental justice, and issues of making sure that the diverse populations in this city are adequately protected in terms of having the ability to choose healthy eating and healthy drinking, because again, we talk about browbeating people, but when you don't have a choice to go except to a liquor store to get your groceries, that's a problem, and that's not necessarily fair to point fingers at communities that don't even have access to healthy eating and healthy lifestyle.
Can you talk a little bit about the legal challenge to healthy San Francisco, and does this at all have any...
Dark cloud has just emerged in the room. Yeah. Well, it's unfortunate. You know, overwhelming majority of businesses in San Francisco are exempted from our mandate. I think that's important to note. The overwhelming majority. We did the mandate not to get money for the program, though the money is important. It wasn't the reason we did the mandate. And the fact is the business community is paying a rather de minimis amount of the overall cost of this program. But it was to create a floor of expenditures, because if we don't create a floor of expenditures, then businesses have obviously the incentive to dump their existing health care or insurance that they're providing their employees. If the city's going to pick it up, then why do they pay for it? And so you have to have a minimum expenditure in order to avoid what we call dumping. It's not because every business would do that, but let's be honest, the likelihood is a lot of businesses would. Thus, your total number of uninsured would go through the roof, and your program would collapse. So we needed that minimum expenditure. That's been controversial, and we recognize that. Restaurants have been hit disproportionately because they have other burdens. The minimum wage has no tip credit, and I've had a strong opinion on that for years. And I think we made a mistake not affording that, and I think that's a big problem, because businesses are being hit with that without a tip credit, and they're hit with this minimum expenditure. And we proudly have, for every 30 hours you work, you get an hour of paid sick leave, up to 9 full days. We're the only city in America that's doing that. And President Obama has talked about doing that for the country, but only San Francisco is doing that. It's rather extraordinary. It is the United State of San Francisco in many respects, in terms of doing things that, you know, people could only dream of in the state of California, let alone this country. So you add all those on top of it, it's driven some frustration. And you know what? I get it probably better than any human being in elected office, because I started 9 restaurants. And I have 5 former restaurants in San Francisco that have been impacted by that ordinance. And I'm sensitive to the economy, and we need to be sensitive to their concerns. And we're trying to address them. In my budget, we include some business relief. That was part of my budget. It's not going to make up for the dollars overall, not even close. And some may dismiss that out of hand. But it's a directional commitment saying, look, we understand the burdens we placed on you. We appreciate the opportunities you provided your employees and our city, but we are sensitive to the fact that this is costing some businesses more than they can afford. So they have sued us. We have won, and we continue to win the lawsuits. The Bush administration joined in their lawsuit on ERISA grounds. We are confident in our legal strategy, and we're confident that will ultimately prevail. They want to continue their lawsuit. I sat down with them, Dr. Katz, myself, just 2 weeks ago, and tried to dissuade them. They have strong opinions, and I'm not sure we were so successful. But that being said, there is an openness by the Golden Gate Restaurant Association, of which I'm a former member, to continue that dialogue, and I'm immeasurably grateful. And they make a strong argument for why this is a very burdensome mandate, and we make a strong counter-argument why this is extraordinarily important, because we believe in the notion of shared responsibility. And that's not rhetorical, and that's not a throwaway line. We're all in this together. Everyone needs to participate. And if we don't, all of us pay the price in our emergency rooms, and we ultimately find our way through fees, fines, and taxes to make up for that.
But should they prevail? I know you think that they won't, but what impact would it have on the program?
We're creative, and we're optimistic. And if indeed that happens, we'll answer that when and if we have to. But right now we're moving forward, and we're getting next level, and we hope by the calendar year to be 85 to 90% there, right, Tangerine?
We're currently at 70.
So we're close. If we're at 70 and you've got a full year, it's only half year. I'd like to think by the end of the year we're pretty much there. But remember, it's not a mandate. Not everyone has to have universal health care in San Francisco. It's an opportunity. And so we think we'll get to that point, that threshold where most people that want to avail themselves will have availed themselves, conceivably by the end of the year or the first quarter of next year. And then by that time, probably the adjudication of their lawsuit, if indeed they want to go forward, and I'm hopeful they don't, will have worked itself out.
And will you be able to allow all income levels to?
Yeah, we want to move forward beyond 500% soon.
We certainly will do that. We'll be looking at that probably in the beginning of next year. As you probably know, we've done the income increments on yearly basis. We just went to 500% in February, so we're going to give some time for that percentage of the population to be able to enroll before we continue it further.
But remember, it's currently, I mean, it's not insignificant. Families of four earning up to $110,000 are now eligible for this. So it hits a pretty broad demographic in our city.
Did you have an assessment of how much money the city is saving with this program instead of taking care of the people in the emergency rooms?
We know that since beginning this program, that using a comparable population, we have less hospitalization and we have less emergency room visits. And that's because one of the features of Healthy San Francisco, and it's part of the individual's participation, is they have to choose a home, and that's where they get their care. So for example, if come July 1 someone chooses Kaiser, that's where they have to get their care. They can't then go somewhere else and say, well, I'm here, I want my care. Right. I mean, so by encouraging the development of primary care homes, really connecting people to their primary care doctor or nurse practitioner, we're able to reduce emergency room use as well as hospitalization.
But you don't have a number?
We don't yet have a number on. We've compared our data to those other benchmarks, but we don't have a dollar number that equals to that.
But we are doing in fact, I think the
Well
board
done.
just recently.
Right. We have a full evaluation that we're doing that's being done by an outside agent. In fact, we cannot yet say the name because the bidding process is not yet over. But one of our commitments as part of this program is it should be evaluated not just by me and by Tangerine and the mayor, but by someone with no stake in it. And we have an RFP that we had several leading firms bidding on, and we'll announce the winner, funded all through philanthropy. We've gotten a number of contributions of people who want to be able to answer the question that you're raising with precision, exactly how much money is saved. And so that effort will be beginning within a month.
Is there a goal, a dollar figure that you're hoping to achieve?
Well, you know, the part of our commitment to the city has been to not increase the use of general fund, recognizing what difficult times these are. And so far, you know, from my point of view, pretty amazing. We're at 42,000 people enrolled, and I haven't asked the mayor yet for any general fund. So that we've been constantly able to expand the program using the dollars that we've gotten either through philanthropic grants, through what the participant pays, or through the employer spending requirement that the mayor referenced. So one goal is I want to expand access. Now, of course, if you provide care to people who've never gotten care before, that part of the care is going to be more expensive, right? I mean, if they've been avoiding, you know, getting a mammogram, and they've avoided getting a pap smear because they can't afford it, and you're now providing it, you're not immediately going to see any savings in money. That's going to cost you more to expand access. But over time, you'll see fewer people presenting with late-stage breast cancer and fewer people developing cervical cancer. So over time, you will get savings. But in the short term, the access costs more, but you can control your costs by connecting people to a primary care home, so you get less hospitalization, less ED use. Preventive care, primary care, attaching yourself as a home so that you don't need the hospital or the emergency department.
Many of the participants have emergency
spellings for us, names and
We'll,
spellings?
we'll take care of that, and I know the mayor has a...
No, that's all right.
Actually, if we could ask the mayor a question about, can we get your reaction to Santa Clara's movie last night on the stadium?
Let's get the spelling done.
Ray, start with you. Your name. They want to be able to...